Let's begin the application procedures. Before you apply the PharmChek sweat patch, you will need the following materials, all of which are included in the patch kit. A PharmChek sweat patch, at least 2 alcohol wipes, 3 if an overlay is to be used, and a chain of custody form. The left side of the chain of custody form must be completed when the sweat patch is applied to the donor. Begin by completing the donor's name, the donor's identification number, and the observer's name. The patch ID number should be recorded for identification purposes on the chain of custody form. This is the number that is printed on the sweat patch. Record the date the sweat patch is applied and mark the treatment or status reason for specimen information. Both parties need to verify the information and initial the chain of custody form. You are now ready to apply the patch to the donor's body. If the donor comes in from a warm and humid environment, the individual should cool off prior to commencing the skin cleaning and patch application protocol. A new pair of disposable gloves must be worn for each patch application. The first step is to select the area where the patch is to be worn. The PharmChek sweat patch can be worn in any of these 3 body areas: the upper outer arm, the lower midriff, or the lower back. An alternative area for female donors includes the upper shoulder blade. Also, the patch may be applied sideways to better fit donors with smaller arms. The upper outer arm is the most common and most convenient area for patch application. A donor should not wear a PharmChek sweat patch when the skin has obvious sores, cuts, scars, ulcerations, or skin irritations such as acne. The sweat patch can be placed over tattoos if the tattoo is light in color and does not contain obvious scar tissue. The area for application should not have excessive hair, wrinkles, or be rubbed by tight clothing. If the donor has excessive body hair, do not shave the area. Instead, choose an alternative body site location for the sweat patch or use standard urine testing. After choosing the area to apply the patch, you must thoroughly and aggressively clean a section of skin larger than the size of the patch with at least 2 70% isopropyl alcohol wipes, 3 if an overlay is used. There are 2 or 3 alcohol wipes supplied for each PharmChek sweat patch in your kit. The alcohol removes oil, dirt, and dead skin cells. Therefore, it is important that you aggressively clean the area of the skin prior to applying the PharmChek sweat patch. If an overlay is to be used to enhance the wear time of the sweat patch, be certain to clean the area of skin that includes the size of the overlay. Using a gloved hand, thoroughly clean the location with at least 2 alcohol pads. Be sure the area is completely clean by observing the surface of the second alcohol pad. If the pad surface is slightly discolored, continue to clean the skin surface with a fresh alcohol pad until the pad surface is clean and free of discoloration. Make sure you let the skin dry for at least 60 to 90 seconds before applying the PharmChek sweat patch. If the alcohol is not dry, the sweat patch will not adhere to the skin. If the alcohol is not completely evaporated, it may cause an alcohol burn or reddening of the skin surface. The next step is to remove the patch from the sealed wrapper. Be sure the number on the patch shows right side up so it can be easily read. Either have the donor flex their muscle or manually stretch their skin where the patch will be applied. This will keep the patch adhering to the skin when the muscles are flexed and avoid a mechanical injury to the skin. Remove the backing from the patch and apply the patch to the skin. Do not stretch or put tension on the patch during application. If the patch is going to be worn on the lower midriff, have the person who is to wear the patch lean backwards slightly to stretch the skin. If the patch is going to be worn on the lower back, have the person wearing the patch lean slightly forward. Now, press the patch against the skin. Rub your index finger around the clear area surrounding the absorbent pad for 10 seconds. This will assure that the sweat patch adheres to the skin. Find the slit in the border remaining on the patch. Gently peel off this border. As you peel the border away from the edge of the patch, rub around the edge of the patch several times. This presses the edges of the patch to the skin, assuring good adhesion during the recommended wear period. A patch that is not adhering correctly will curl around the edges. The client can now relax their arm. When using the overlay, you'll proceed with the same application procedure that you used with the sweat patch. Center the overlay over the just applied sweat patch. Prior to removing the outer border, press all areas of the overlay to the skin for about 10 seconds. Find the slit in the outer border and remove the border. While removing the border, use your free hand to gently apply pressure on the outer edges of the overlay to assure proper adhesion during the recommended wear period. If a large enough area of the skin was not cleaned, the overlay will not adhere correctly. Now the observer must sign the chain of custody form in the area marked Observer Completes. Place the chain of custody form in the appropriate file and instruct the donor as to what day they are to return for the removal of the PharmChek sweat patch. The important points to remember when applying the PharmChek sweat patch are: choose the area where you will apply the patch. Thoroughly and aggressively clean the skin. The patch will adhere best to skin that has been cleansed of oil, dirt, and dried skin cells. Make sure the patch adheres well to the skin surface. The patch is easy to apply, but you must remember to press the patch to the skin so that the adhesive adheres completely.